Topic is epigastric hernia. Hello dear students, we will discuss a topic in the abdomen today. Again, not uncommon. See that here in the above the umbilicus is swelling here. So you have to look for expansile impulse on cuffing. You know, expansile impulse on cuffing is momentarily increasing the size of the swelling during the or appearance of the swelling during act of the straining or coughing. And other possibilities are you have to think of other than epigastric hernia is abdominal wall lipoma, abdominal wall soft tissue tumors, and so on. First thing is always common thing, that is epigastric hernia. It's a fatty hernia of linea alba. There are decussations in the linea alba like this. So in between there is a weakening of the decussation occurs. Fat, established fat comes out. So initially there is no sac. This fat eventually pulls the sac, and typical peritonic sac, peritoneum comes forward, becomes a sac, and along with that content, either bowel, small bowel or omentum comes. Eventually bowel can become irreducible, can get obstructed, can get strangulated like any other hernia complications, and eventually it may get enlarged adequately. Many times it will be not single defect, multiple defect, one large, then small, large, like this. Small one is here, one is here, one is here, one is here, like that. Swiss cheese patterns, very, very typical. Swiss cheese pattern. Now important thing is entire area has to be covered and dealt with the proper mesh in this patient. And common in males, 20% Swiss cheese pattern, already told. It may mimic peptic ulcer. The point is important. Same, mimic peptic ulcer disease. So many times in this patient, you have to do ultrasound abdomen, of course, to find out the defect, everything. But you have to do astroscopy also. There may be a peptic ulcer disease. So do gastroscopy in such suspected patient. Detailed history of pain, whether there is heartburn, whether there is a hunger pain, whether there is a pain related to after taking food. In such situation, it may be due to peptic ulcer disease, and you have to do gastroscopy and to evaluate or rule out the existence of the peptic ulcer disease. So DD is abdominal lipoma or soft tissue tumor. I already told. Ultrasound CCT abdomen is done. CCT abdomen is done. Defect assessment is very, very crucial in this patient. Remember, you have to defect, always I said horizontally. Treatment specific factors should be treated first. Preperitoneal or retrorectus mesh repair, component separation technique, IPOM plus intraperitoneal onlay mesh repair with the closure of the defect. IPOM plus is a standard one. Component separation is a large one, not in this. Or open mesh repair also, usually preperitoneal or retrorectus mesh repair. Onlay mesh repair, per se onlay in front of the defect mesh is not standard technique because recurrence is very high. Preperitoneal or retrorectus mesh deep to the defect orifice is a standard this one. Otherwise, laparoscopically intraperitoneal mesh repair where defect should be closer with the polypropylene or vehicle suture. So that's what is called IPOM plus. So CST in a large one where there is a loss of domain, not in these patients. So epigastric hernia is a common short note. Oxy they will keep, then Viva they will ask, MCQ they will be, which is sackless hernia, MCQ. We should know these things. So 20% Swiss cheese pattern is very common. If you miss one of the defect component, then recurrence can occur. So wide mesh you have to place like this. Big wide mesh you have to place, remember. So answer the MCQ. Richter's hernia is common in indirect inguinal hernia, direct inguinal hernia, femoral hernia, umbilical hernia. Put the right answer in the comment box. I will get back to you for the answer later. So when Meckel's diverticle is present in as the content of the hernia, it is called as A. Lattice hernia, B. Amiens hernia, C. Richter's hernia, D. Romberg's hernia. Find out the right answer. I will give the answer later. So students, always go through my SRB clinical methods and surgery, where everything, examination part, of course in video, how to examine is there in my book through JP Publishers, 4th edition. It contains all topic, for example, mass abdomen, swelling, ulcer, artery disease, venous disease, thyroid, and so on. All topics with the video contain lot of photos and illustrations. I hope you have understood this lecture very well. Thank you so much.